Welcome to Shaping Healthcare, a podcast by CitiusTech. I'm your host, Laurel Rockall.
Joining us today is Krish Purushothaman, Vice President of Implementation Services at CitiusTech. Krish leads the Smart Automation and Implementation Services team, focusing on driving digital transformation through AI-powered low-code platforms and robotic process automation. Join us as we delve into the intricacies of revenue cycle management and explore how innovation is reshaping the financial landscape of healthcare. Krish, welcome to the podcast.
Thanks for having me, Lauren.
Great having you back. Looking forward to our conversation today about revenue cycle management, RCM. And the question I want to start off with is why? What is the necessity of intelligent automation in healthcare?
So as industry is evolving, especially in healthcare, the introduction of intelligent automation is just not a trend. It's an absolute necessity. And the reason I'm saying is it's driven by both operational and patient care imperatives. Okay, so let's try to break it down, and I can highlight the areas where automation is making a profound impact in RCM space. As we all know, healthcare systems are overburdened by administrative workload. If you go to a doctor office, and obviously, as part of patient intake, like they will ask for your insurance information, they will ask for your demographics and things like that. It's all burdened with a lot of data entry. And once we get into their system, there is a background process that happens again, in terms of eligibility verification, billing, and then scheduling and claims process. There is a lot of manual effort involved, and that brings an opportunity for enhancing efficiency and reducing the administrative burden. And when you do that through automations, improving accuracy, right? When you do this, when system does it, it has a better accuracy. There is not a lot of room for errors, so it reduces the human error. It makes it like bringing in so much accuracy, and then reducing the administrative burden, so that the administrative team can focus on the things that are really important in patient outcomes. And by doing all of this, it really enhances the patient experience, right? When you think about, you providing in the information of your demographics, your insurance information, things happening smoothly behind the screens through this automation, that really enhances the automations. Like either it is a, personalized follow-up notification, or even with the virtual communications in terms of AI-powered chatbots. Those are the areas that where we see that automation is really enhancing the patient engagement. And I also wanted to mention the compliance and risk area as well, where we all know that healthcare industry is heavily regulated, and automation can help ensure that there is the necessary protocols has been followed consistently, and by reducing the risk of non-compliance with associated legal consequences. That's one area that we see that automation can have a profound impact. And last but not least, I want to highlight the enhanced version of IPA, where more and more complex decisions can be made through intelligent automations. And when you pair AI and machine learning with the automation, that's where you see this, all of the complex decisions can be made based on the data, and it's all data-driven decision support rather than relying on some instinct. So it's all evidence-based decisions that can be done through intelligent automations. So overall, Lauren, if I think about it, intelligent automation helps solve some of the core challenges that industry is facing today, right? From operational efficiencies, rising costs, and administrative overload, and reducing human errors, and reducing the inconsistent care. And that's why this intelligent automations not only improves the operational performance, but also delivers the high quality and more and more of personalized care to the patients.
Krish, you mentioned some really great areas there, a lot of very key areas, from cost savings, compliance, very important, the time efficiency piece. Hospitals and medical clinics are frequently finding themselves understaffed or bogged down by that quote unquote, busy work, that administrative burden, having that automation in place certainly sounds incredibly helpful in a lot of ways. And I want to dig a little deeper into that. What are some of those key processes in RCM that have benefited the most from RPA implementation?
Yeah, so if you take a look at it, revenue cycle management is the backbone of healthcare organization, especially with the provider organization, encompassing the entire process from patient intake to the payment collection, right? Given the complexity that goes in, the administrative burden that goes into each and every processes of RCM, RPA has emerged as a transformation tool to streamline some of these process and reduce manual efforts, like I said, and improve efficiency thereby. So most of this times where we have seen RPA come in handy, when a particular task cannot be handled by native application. When business operations looks at improving their claim denials or reducing the claim denials, they are looking at, I want to get something done. Some of the areas where they see challenges, their native application like an EHR, EMR couldn't handle it right away. So that's when this automation, RPA especially, comes in handy. So if you want me to break down on the RCM process that they have benefited most from RPA implementation, we need to probably take a look at step by step on the areas where RCM is kind of focused on. So let's take a look at patient registration that we talked about. The way that we can help this operation folks reduce their manual effort is by deploying automations. By deploying automations in terms of verifying the eligibility, scheduling based on priority. The good thing about is scheduling happens even in the current world, but there are areas where if you need to do a priority scheduling based on specialty, or if you want to remove the duplicate referrals, right? If that is sitting out, that takes a lot of manual effort to remove those duplicates. Those are the areas. And also another area is like closing the care gaps. That's another interesting area where we see that RPA come in and look at those care gap orders, and vendor close those care gap orders. And another area where we are seeing is more of, like I said, eligibility verification. When we call in for a doctor appointment, we provide our information, and then doctor offices wanted to manually get into their portal websites and kind of gather the eligibility verification. That's a manual effort involved. So that's an area where we see that automations really can reduce some of the burden on the administrative efforts. Another area, Laurel, that I can think of is coding. When it comes to revenue cycle management, it's important that we get through the claims at the first pass, reduce the denial. So that's where coding becomes really, really important. That's an area where we can automate bots, look at some of the notes being captured by clinical notes that has been captured by the provider, identify if there has been a right ICD code or CPT code that has been coded, so that the claims doesn't come back with the denial. Obviously, when claim submission goes through, there is also follow-up, like plans always makes their rules, and as we go through the submissions, we learn a lot that your claim has been rejected for so and so reason. So that's another area where automations can come in and help identifying a pattern, coming up with the rules where those rules can be applied so that the subsequent claims can get through in first pass. There is also another area, Laurel, that I want to talk about is payment posting. We need to reduce that posting cycle. As soon as a payment is done, we need to reconcile if there is a discrepancy there. And that is another area where automation can and come in and help identify if there is a discrepancy and flag it to our operation folks, rather than operation folks looking at each and every payment posting, making their manual posting done in the EHR or EMR. So that's another area that we are seeing. The last important area that I want to highlight in the RCM space is denial management. That has been getting a lot of attention in the industry, that every provider that we speak with, they come back saying, how do I reduce my denials? That is the key. That is the backbone of how I can optimize the RCM, the whole RCM optimization, part of that initiative. So we need to look at those denial management, and that's an area where automations can be deployed, identify the patterns, and identify the likelihood of claims that is getting denied based on the data, and take some appropriate actions, by automating it and flagging it to the operation books, so that operations team doesn't look at entire denial data. They look at the specific data, thereby reducing their manual effort that goes into it. So those are some of the areas, Laurel, that I can think of where, in the revenue cycles space, where automations can add more value.
And those are all fantastic areas that you mentioned. I mean, any speed and efficiency that can be, anything that can be improved in the revenue cycle is a win across the board. To dig a little deeper into that, can you share how intelligent process automation is transforming RCM within provider organizations?
Yeah, so that's an interesting question, Laurel. The reason I say that is organization has traditionally seen the automation, the plain vanilla automation. Now, as industry is moving towards intelligent process automation, it's really reshaping the revenue cycle management automation process, especially with the provider organization. When you think about it, infusing advanced technologies like artificial intelligence, machine learning, and natural language processing, infusing all of those into traditional RPA makes it an IPA. Actually, this enables the healthcare providers to automate more and more complex decision-based tasks, to go beyond simple automation, driving greater efficiency and more accuracy, and that gives insights into the financial operations. So that's the beauty of shifting more from plain vanilla automation to intelligent process automation, and towards hyper automation. Some of the key transformations in this space includes, again, the key important thing that we discussed about predictive denial management. Like, we have lots of denial data available. As we put through the claims, we get back the denial data from plants, and with the artificial intelligence, with the LLMs available, we'll be able to read the claims data, and the prediction can be made on the likelihood of specific claims getting denied based on historical data and the payer trends and the denial reasons. So predictive denial management is another area. It's more and more AI getting implemented, trying to improve the accuracy and reduce the denial rate. Another area that I want to highlight is, Laurel, intelligent coding. So all these things happening, right? We need to make sure ops team, the operations team, submits the claim with the right ICD code, CPT code, and all the HCPS, PCS codes, and things like that. So we need to make sure that is in line with the physician notes and physician documentation. That's an important area where I see that natural language processing can read through the notes and then make sure that the codes that has been submitted with the claim is in sync or intact. So that way, there is a possibility that we can capture upfront on the claims that is going to be denied by the payer. And obviously, payment posting and reconciliation, that is another way of automating and trying to understand what is the payment pattern that based on patients' behavior and patients' historical data. We talked about complaints also. Complaints is another area. It may not, directly tied to a revenue generation, but it's more of, it will, if you are not compliant with the regulations, there is going to be more of auditory, regulatory inspections that may lead to heavy penalties. That's an area that where we can see really IPA making a big way in terms of flagging those. And the last point where I want to highlight is, with all this data having coming in. And in the revenue cycle management, you need a dashboard. You need something that where you can see all of the predictions coming on. So real-time revenue cycle analytics is another area where this IPA is going to come in and identify the bottlenecks fairly quickly and highlight the areas of concerns and flagging those for operations team to work on. So these are the areas that where I see really IPA is transforming, some process or the specific process in the revenue cycle management, Laura.
That's amazing. Could you walk us through maybe a real world case study where the RPA made a significant impact on RCM?
Yeah, that's I definitely wanted to highlight one of the case study or one of the implementations that we have done, which has been challenging, but ultimately it ended up with an very good results with this customers. This is a large US based healthcare or a health system, and they have about 18 facilities in their network, and there was a lot of inefficiencies that we saw in their revenue cycle management process. This is despite of they have a dedicated billing team, they have a very efficient ops team, trying to take care of the claim denials, slow reimbursement cycles, and all these things. They have dedicated team to take care of it. When we engaged in the discovery session, we wanted to go with the goal of how can we improve the claim denial rates, how can we reduce the claim denial rates, how can we improve the claims to go through in fast pass with a greater acceptance rate, and how can we accelerate the payment posting and accounts receivables and flag some of those discrepancies. Those are the key objectives that we had when we started this engagement. And obviously, when you look at these three factors, there is going to be and find opportunities for automation. There is going to be a lot of focus in relieving some of the workflow or manual effort that is happening, so that the effort that has been spent on those activities can be devoted to a higher value task. And when we do all of this, obviously, you will see that patient satisfaction and the billing process improved and all that patient engagement and all that is happening. So with that in mind, we approach this problem, and the challenges that we ran into, especially with this organization, was right from manual data entry, right, patient registration as part of the intake process, eligibility verification, claims, there are so many areas where we saw repetitive manual data entry happening. So that becomes an opportunity for automation. And then we also looked into some of their coding practices, and that's an area that where we wanted to see where the errors are coming in, how the errors are coming in, and that is an area that we looked at. And obviously, their current denial rates, it was around 25% at that time that they had the claim denial rate of, and that's all due to billing errors and incomplete documentation, not having reference and things like that. So we looked at those three areas. Another area we also looked at is the slow payment posting. As soon as this accounts receivables come in, and we need to really flag in so that we don't, the information that ops team is working on is more accurate. So those are the four areas that we looked at it, Laurel. And it was a great, amazing effort. Obviously, when you approach, operations team, we always see that there is always, bot is now going to do this, and what is going to happen after, bot takes over all of the days. Always that fear is there. We have to work through, identify the backlog and prioritize the backlog. And then we did the ROI, and then we put that list of top priority items that can influence directly on the optimization effort on those four objectives. So, it was a great success where we saw improvements in each and every area. There was about 6 minutes per intake process per patient. When somebody calls in, they have to go in and verify the eligibility. That process has been automated. So now bot took care of it. And after that, In the claim submission area, we deployed bots to look at those denial reports and categorize those reasons. Bots took care of those effort, and manual effort right there can be freed up. So in the sense, like, they don't have to look at the entire denial data. It has been orchestrated in a way that it can be routed only, or it can be flagged only the things that upstream have to look into it, so that this process has been automated. There we have seen about 30% decrease, overall. So payment posting and reconciliation, obviously, we have to reconcile those if there is an underpayment or overpayment, and make sure that that posting gets done. There also we reduced about the manual effort by 50%. And a denial management and rework, that denial management and rework, we deployed bots that flagged the denial patterns, enable the ops team to address only the issues that needs manual intervention. Otherwise, it should be systematically updated with the right coding or missing authorizations and things like that. Bots were able to take care of it. So we have seen great success with that. And we also looked at putting a bot in the coding assistance area, where it looked at the documentation done by providers, and made sure that the ICD codes or the CPT codes and all of those codes are intact with the clinical documentation, so that it doesn't come as a denied claim. So with that, we were able to improve the first pass claim within greater acceptance rates, thereby reducing the claim denial rates as well. We accelerated, bots in fact accelerated the payment posting without waiting for somebody to take a look at it. And with all of this, we freed up the greater extent of manual effort that went in. And then this customer was very pleased with us, with the whole exercise that we had gone through.
Those are really impressive numbers. Yeah, and it sounds like the outcome was very positive. And processes like this sound like they're going to help all the humans that are involved, and across the board with this, bringing more ease, less error to data processing, getting claims paid faster, better accuracy, a lot of great positive things there. But something that you did mention was there is a little bit of a challenge or a learning curve as one tries to implement these processes as you go through it. But ultimately, that it's worth it. But I want to talk about implementations and those challenges. What are some of those challenges you faced in automating RCM, and how do you overcome them?
Yeah, it's interesting you bring up that question. So it's not easy, right? Especially with the larger health system, with multiple groups working on multiple areas. And you can see in a larger organization like this, it's a siloed approach, right? Right doesn't know what left is doing. So there is a lot of things that was worked in silos. The main challenge that I want to highlight is when we work with operations folks, they are day to day doing that repetitive tasks. And sometimes we have to make them understand. Sometimes we need to just put them in a perspective that, hey, if you are spending this many time, this much time on these many tasks on a day, on a repetitive manner, that is a good candidate for automation. From automation perspective, automation team knows that, there are multiple ways to streamline it. Either, streamline the process first, or try to take care of automation as part of the native application, then look at, if an RPA would be or IPA would be a good candidate. But then you need to put that perspective in front of operations folks, so that they kind of see that, hey, this is what we have done with other clients. This is what we have seen results by automating this. So that is a little bit of a learning curve on both sides, from business standpoint, from technical standpoint. All the stakeholders has to come together and get a buy-in from the operations folks that, hey, this can be automated, or this should be automated for better accuracy, for reducing the effort and errors and stuff like that. So there has been a little bit of a learning curve working with them, trying to make them understand. That's one of the challenge. But obviously, we can overcome that challenge by more and more of educating, providing them more examples and things like that. And when it comes to automation, always we look for ROI, right? Return on investment. Automation takes effort and time. Some of the automations, involve some subscription with the tools and things like that. ROI is another factor that we need to consider when it comes to RCM process. Our ROIs can be done differently, but ROI is another factor that we need to look at in a way that not in a straight dollar value, but also looking at more of an compliance standpoint. What happens if we get into penalty? What happens if this task is done not done in a timely manner? So ROI is another thing we need to look at a different perspective and come up with a right decision on whether this is an automation that can be a better candidate that will yield the results that we are looking for. And certainly, there are other challenges as well, in terms of how do we integrate with this existing system. EHRs, EMRs, they are very, very restrictive in what they can expose and what we can automate. So that's one area that we need to consider, and that's a challenge that we need to work through. Obviously, as we move more towards IPA, intelligent process automation, you rely on data to make some decisions. Like data quality is another important challenge that we need to go through. And last but not least, the scalability is another thing. Like, let's say if you are automating a claim status update process, which takes 100,000 claims or 10,000 claims for, let's say, each claim takes like a minute to process the transaction. So that's a huge effort. Scalability is really important. How fast you can process, how soon you can process. So those are the couple of challenges that typically an organization would face before automating any of the RCM process.
You mentioned ROI. How do you measure the success and ROI of RPA initiatives and RCM?
Yeah, so that's an interesting question. The reason I say that is ROI can be looked at from multiple perspectives. For a simple automation, ROI can be on different factors, but especially with RCM, organization should consider like a couple of approaches, like quantitative, based on quantitative metrics, and sometimes we need to really look at the quality of the outcome, right? So from that perspective, straight directly, we can say in cost savings, how much cost savings an automation can bring in, how much reduction that then this automation can bring in terms of claim denial rates, and how fast we can reduce the posting of the AR. So those are some of the metrics. Typically, we look at it from RCM standpoint, and ultimately, leadership team should look at from the qualitative metrics standpoint, right? How is satisfied employees, or how much engagement that we are getting from patients. So those are a couple of ways to look at it from a RCM standpoint, Laura.
When it comes to automation, sometimes I feel there can be this knee-jerk reaction of maybe some misconceptions or some hesitancy in moving forward with something like that. What have you found that are some misconceptions about RPA in healthcare that you would love to debunk for us? Get the information out there.
Yeah. It's we see that all the times. When we get into these types of engagements, especially in the automation business, we always hear that RPA will replace human jobs. That's a natural thing. When bots, when we started hearing bots in the industry a few years ago, bots will take over the human jobs. But contrary to that beliefs, right? RPA aims to augment human roles by automating repetitive and manual tasks, right? And what eventually the outcome of that is freeing up that staff to focus on more complex that only humans can do, like a patient-centric activities. So that's what I have seen. Initially, there is a fear that, if I'm going to automate this process, what is the next thing that I'm going to do? And that brings in, that is part of the challenge that we deal with, right? That brings in a challenge that sometimes it's hard to identify those process, even though that could be automated. We need to get a buy-in from business team. So I would say that is something that frees up the manual effort to focus on more patient-centric activities. And then another thing that I've noticed as well is that, RPA implementation is too costly. Yes, there is an implementation effort involved. There is a subscription cost involved depending on the tool that we are going to adapt. But organizations can smaller provider organization even start with a smaller automation with less expensive by going through by starting with a script and adapting a tool which is less expensive. So this is another myth going on, like, oh, I need to consider a very expensive tool to automate it. That's not true at all, is what we have seen. You can do a simple automation and scale as you grow based on the ROI that we see. And another thing that I have noticed is about the flexibility, and RPA is only for larger organization. Now, knowing that we can do this automation with a simple script, and knowing that we can do with even less expensive tools, this can be tailored to fit to their organization sizes. So, that's another myth that's going on. So those are the things that I could see that I can point out, Laurel, here.
Thank you for saying the record straight on those. Certainly, when it's the work is smarter, not harder, and it sounds like when you're working harder and you can burn out the staff, it can cost more money. And so it sounds like it's definitely very helpful in all these areas. As we look ahead to the future, Krish, can you discuss with us any upcoming trends or advancements in RPA that could further benefit the revenue cycle management?
Yeah, so like we were discussing, we are moving away from traditional automation, right? There are some use cases that we do simple automation, but more and more AI coming into play. More and more we see that results happening using or infusing AI into automation. So there is a lot of areas where we see RCM could get benefited, especially the claims denial management, where you can um, predict the patterns of denial and identify those business rules that can be applied subsequently. So that is an area where we see that more and more experiment is being done and trying to reduce the claims denial issue. And then another area that I want to highlight is uh, autonomous coding. So coding is another area where physician has to document the diagnosis and all that and make sure that that translates into the coding. So as as we see the AI coming in, as we see intelligent process or hyper automation coming into play, that's another area that is going to be, tightening up in terms of placing in the right codes, making sure that the authorizations, prior authorizations in place, and all that is going to come into play. And see, as we all go through this process, try to find out what is the art of the possibility with AI. There is also growing ethical consideration and ethical governance that needs to be built. So as industry evolves, you will see that more of putting in ethical governance around AI, and in a way that you have all of the ethical consideration while you implement while you put AI at work to improve or optimize the whole process.
Krish, we've talked about a lot of really great, overwhelming benefits of RPA to the revenue cycle management. And really, to wrap things up, what advice would you give to healthcare organizations that are just starting their RPA journey in RCM?
Yeah, so we don't want to overwhelm with the entire process, and that's what happens. Like, oh, my claim denials are at 35%. Where do I start? How do I look at the overall process, and how can I fix it? Where can I fix it? Right from intake to the payment, there is a lot of process involved. So let's not get overwhelmed with it. Let's take a strategic approach, look at those areas specifically, work with operations, start automation small so that we can scale as we automate things. Now, a couple of problems that we see, especially with organizations starting new, identifying a tool, right tool, whether we need to streamline the process or whether we need to really directly put into automation, it's a overwhelming process. Start with small, identify the process, build a backlog, perform an ROI, and ROI in the sense from the revenue cycle management perspective, where you see those objectives are met, and start with smaller automations. And then as we grow with the automations, expand upon additional tools, bring in additional tools, and then see how we can scale up the automation in based on the results that we are seeing. That's what I would say. I would say that start with small, scale as we progress, identify the based on how we identify the opportunities, what ROI that we get.
That's excellent advice. Krish, thank you so much for sitting down with me today and chatting with me. It was very insightful, and we really appreciate you bringing your expertise to the table to us today.
Thank you so much, Laura.
The Shaping Healthcare podcast is brought to you by CitiusTech, a leader in healthcare consulting and IT services. To find out more about CitiusTech, visit CitiusTech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to the Shaping Healthcare podcast. Thank you for listening. If you want to share any feedback or would like to be featured in our podcast, do write to us at citiusvision@citiustech.com.